Humoral medicine. Well, let's talk about humoral medicine. Our paradigm for medicine, and this is where we all started. If it's wet, we dry it. If it's hot, we cool it. If it's acid, we neutralize it. If our blood pressure is high, we lower it. If it's whatever, you know, we have thousands of laboratory studies that we rely on, and we always try and make them more normal, because balancing is what it's all about. But we fail to take into consideration that we are complex, and what's balanced for this situation may not be a good balance for that situation. We need to recognize the body's interactions. Bloodletting is an example, and I'll just talk about bloodletting for a minute. But bloodletting was the symbol of medicine for thousands of years. Knife and a scalpel is now what is a stethoscope. This was the most common treatment in medical care for almost 3,000 years. It was done when the body was diagnosed as having too much blood. And too much blood was represented by redness, by swelling, by pain, by fever. If you went to a doctor with those symptoms, you would be bled 200 years ago. Yeah, 200 years ago, because it was still around then. What is that doing? When, okay, redness, swelling, fever, pain. In Latin, what are they? Rubor, dolor, calor, tumor. How many of you doctors know what that means? Yeah, that's the inflammatory response. Okay, so we have the inflammatory response, which is a defense. What does bloodletting do to the inflammatory response? If I injure my ankle swells up, hurts, gets red, I would get bled 200 years ago. Probably didn't do any harm for my ankle. But the redness, the swelling, helped split my ankle. The pain said, stay off of it till it gets a chance to heal. It was a defense. It helped me live another day. When you bleed someone, or when you give blood now, or when you're injured in an accident, and you lose enough blood, your body compensates for that blood loss by shutting off your circulation to your extremities to save it for the central organs. It's called shock. And when you bleed a person with an injured ankle, you can watch the swelling lessen, the redness lessen, the pain lessen, as the blood to their leg is shut off to save it for the... It's a fantastic treatment for the condition of redness, swelling, whatever. But it hurts the body. And when we finally did some studies on people with pneumonia, we found that out. More of them died. So we stopped bloodletting, and now we practice scientific medicine. But scientific medicine just has expanded our range of humors, because we still use the same thinking. We analyze things. We take them apart. We find that we're interested, for example, in a reaction that will help us deal with pain and arthritis. And so we cut through all of these connections, and we find a reaction that is interested, a COX-2 reaction, and we build a nice new drug called Vioxx, and we give it to people, and it works wonders because it takes their pain away, it takes their inflammation away, but more of them die. Why? Because we've cut all these connections that are really the meat of our complex adaptive system, and we ignore those because they're not what we're interested in. But they bite us in the rear and they wind up killing us because we are complex. We're not mechanical. We can adapt. Machines can't adapt. So the current paradigm is scientific medicine. But it focuses on analysis and reduction and tries to find the fundamental parts. And Mary's doing that. But you need to do that because we find out a lot. And I'm not faulting that. What I'm faulting is that we need to recognize that when we do that, we're cutting through connections, and the connections are what make us as rich as we are. The people who did the human genome study, their conclusion is that genes interact much the same way. They're connected much the same way. And we will not find the basis of our humanity or our complexity by analyzing the genome. We continue to treat the body as if it was a complex machine. But machines can adapt. The paradigm that we are proposing, and it is a paradigm because we need to see differently, is that of complex adaptive systems. Because adaptation is a characteristic of life, and all forms of life are complex adaptive systems. When you try and analyze us and the number of interactions that we have, our connecting interactions are larger than cosmic numbers. Seeing us as complex adaptive systems is congruent with evolution, and it recognizes the importance of our defenses. And our defenses is one of the major things we've been talking about. So the conclusion for today is bacterial infections may be prevented without prompting resistance by blocking their transmission, like Ewald says, or their adherence, like we point out. Both of these methods apply pressure on the bacteria to adapt toward less virulence.